Hi everyone. Today I'm going to discuss about some image artifacts in the MRI. We know that the image artifacts in the MRI is the unwanted data or the signal occurring during the imaging procedure. Today I'm going to discuss about some of the imaging artifacts in the MRI. First, we are going to discuss about zipper artifact. The zipper artifact is a dense line on image at a specific points. This may be caused due to some hardware or software errors, or maybe due to RF leakage. How to resolve these things? We cannot do any hardware or software problem. We cannot do anything. And we should ensure the door, MRI room door, is closed properly while acquiring the imaging. And should ensure no any metallic implantable devices, electronic devices in the patient body like ECG or any pacemaker or something. It also may cause this type of artifact. After checking this all considerations, and also we are facing this same issue, we should contact with our service engineer to resolve and find out the reason of this artifact and to resolve it. Next, we are going to aliasing artifact. Aliasing artifact, we everyone saw this once or many times in while imaging. This is caused due to a FOV. The field of view is smaller than the part being imaged. For example, in we are doing the orbit imaging or the ISE imaging, we are using some short FOV scans. When doing this short FOV, the remaining part of the image is overlapping the uh, overlapping the actual record uh, field. It is aliasing artifact. We can resolve this artifact by increasing the field of view, but maybe it's not possible at all the time. Maybe we need a shorter 4V scans, so it's not possible at all. If it's possible, like to do it. And we can use some saturation bands outside the field of view, and we can use the no phase software also. And we can switching the phase encoding direction. For example, the knee joint, the phase encoding direction is superior to inferior. The image will getting the phase proper artifacts. To resolve, we can change the phase direction to right to left or right to left or something, and use dedicated surface coil. While using the surface coils or dedicated coils, we will get the RF signal in the region of interest. For example, if we are doing the wrist scan, we are using dedicated coil. The signal is limited on that region, so we can avoid this aliasing artifact. Next, phase encoded motion artifact. This is maybe due to patient movement or involuntary movements like pulsating or peristaltic movement and breathing. These and all may be the reason for phase encoded motion artifact, and it is actually caused due to tissue or fluid moving during the scan. To reduce this artifact, we can use saturation bands on over the moving structure. For example, for while acquiring the spine imaging, we can use saturation band over the neck or the abdominal region to avoid peristaltic movement or respiratory movement. We can use respiratory gating or cardiac ECG gating while doing the abdominal imaging or cardiac imaging, and we can switch the phase encoding direction is for avoid pulsating artifact in the knee joint or something. And we can increase the nets also resolve this kind of issue. And for if the patient is not cooperative and due to patient movement, we cannot do much anything about that. So we can reduce the scan time as much as possible. Then the patient movement time will be reducing, will reduce the artifact. Next, we are going to metallic artifact. This may be some foreign body or foreign material in the patient, like hair clips or slide or something, or any ornaments that patient wore, or any dressing have any metallic contents. It may cause this artifact. So ensure before getting the patient inside the MR room to ensure there is nothing in the metallic object in the patient body. We can do screen with the metallic detector, or we should change the in the hospital gown or something to change every dress or every wearing of the patient. And some implantable devices or implantable metallic devices in the region of interest also cause this metallic artifact. To reduce this artifact, we can use some special softwares like metallic artifact reduction software available in the modern MRI scanners. Next, we are going to crosstalk artifact. We saw this mainly on the spine imaging. This is caused due to a group or slices is overlapping together. It will cause some dark bands on the image. To avoid this crosstalk artifact, we can reduce the angle between the slices uh, to overlap. We can reduce that overlapping angle, and we can increase the slice gap, and we can also use separate acquisition, maybe in the like lumbar spine imaging. Maybe some patient have more uh, maybe some patient need more tilting. It will cause the crossing of the slices. So if your images occur during this artifact will not inappropriate for the diagnosis. So we can do separate scan for that region and use and we can reduce the flip angle also, reduce this artifact. On my presentation, this is the last artifact I am discussing with you. That is a shading artifact. The shading artifact we saw in while imaging as some different intensity signal on the imaging volume. Like the image is showing the anteriorly we have some dark area, some reduced signal on the anterior or on the anterior region. So this is goes due to some different causes, maybe uneven excitation pulse, RF pulse applied other than 90 or 180 degree, and abnormal loading of the coil, the inappropriate loading of the coil, and the coil is touching with the patient. So to avoid this, should ensure the coil is properly connected with the coil port and the coil position is properly proper, and make some pads or something in between the coil and the patient. And we should ensure the excitation is correct excitation pulse is applying for each acquisition. And this is all I'm discussing about MRI artifact. And thank you for watching.